to identify problems with insomnia, first of all, is just listening to patients and their description of their sleep. If their description is one of trouble getting to sleep or what we see as perceived awakenings throughout the night, then that is consistent with insomnia. Not always, but sometimes we can go on to prove that in the sleep laboratory, where we invite someone to the laboratory and watch their sleep overnight. We hook people up to a variety of monitors, devices that can monitor respiration, sleep stages, brainwave activity, and things like that, and we can determine whether there are frequent periods of wakefulness throughout the night or otherwise insomnia. Treatment plan for patients with insomnia are after an interview, an examination, we try to identify what are the likely factors that are maintaining problems with insomnia. If we suspect a physiologic basis or an organic disorder, sleep testing may be required. And in that, we're looking for sleep apnea, for example, which would require treatment with a CPAP machine or a sleep machine. Patients with restless legs may benefit from medical therapy or alterations, changes in medicines that they may be taking that could contribute to that disorder. We've already talked a little bit about the importance of sleep hygiene, and often, sometimes, therapy along with a counselor or psychologist may be helpful for many patients with chronic insomnia. Because again, sometimes it's depression that can contribute to the problem with insomnia, but also the treatment is made better in many cases with discussion with a therapist as well. There can be definite benefits with therapy for insomnia. However, that said, many patients with insomnia have had insomnia for months to years, and it can be a relapsing condition. And so those rules we talk about, the rules of sleep hygiene, are rules that can't just be abided by for a few weeks to months. They really are lifelong lessons that need to be paid attention to. Otherwise, the insomnia can relapse. It's a program that requires constant adherence to, and they need to adapt that to their daily lifestyle.